So let's start with Andrea Villanti, who is Deputy Director of the Rutgers Center for Tobacco Studies and an Associate Professor in the Department of Health Behavior, Society, and Policy at the Rutgers School of Public Health. She also holds an adjunct faculty appointment in the Department of Psychiatry at the University of Vermont Larner College of Medicine. Dr. Villanti's primary focus is on young adult tobacco use, including predictors and patterns of use and interventions to reduce tobacco use in young adults. She also has experience in population surveillance of tobacco and substance use and translational research to improve substance use-related policy and program decision-making, including within tobacco regulatory science. She received her doctorate in social and behavioral sciences from the Johns Hopkins University and her master's in public health from Columbia University. Without further ado, I'd like to welcome Dr. Villanti and invite her to start her talk. Thanks.
Okay, excellent. Just confirming you can see my slides.
Looks great.
Great. Thank you. Thank you so much, Alex. Thank you to all of you for having me. And I'm excited to kick off this session and talking about one of my favorite topics, flavored tobacco use and the relevance to policy. As Alex mentioned, I'm Deputy Director at the Rutgers Center for Tobacco Studies and representing the UPenn Rutgers T-Cores. I have funding from NIH, FDA, and HRSA, and I served as an external reviewer on FDA's scientific assessment of the impact of menthol in cigarettes. I have no other relevant disclosures. So as we know, last April, we had FDA release a proposed rule to ban menthol cigarettes and flavored cigars, highlighting the importance on preventing youth initiation and reducing tobacco-related disease and death. And as we hope is coming, the unified agenda that was put out in the fall identified that this final rule should be promulgated by August of this year. So this is marching forward. Of course, the tobacco companies have their spin on what is coming down the road as well. And I just wanted to highlight that in many of their annual reports and other communications, they have highlighted that the weight of published science does not support regulating menthol cigarettes differently from non-menthol. And specifically, they highlight that the scientific evidence does not indicate that menthol cigarettes adversely affect initiation, dependence, or cessation. So we're going to run through some of the studies that have been done, more recent studies that highlight these relationships, and then talk a bit about the market and why we're seeing such strong pushback from tobacco companies. So in terms of initiation, what we have seen is that among new users of tobacco products, first use of flavored tobacco is higher among youth and young adults than adults. And you can see that's a pretty consistent pattern across any tobacco product, e-cigarettes, any cigar, hookah, and smokeless, though it's not different for cigarettes across age groups, largely related to the fact that there is only one allowable flavor on the market right now, which is menthol. We've also seen that first use of a flavored tobacco product is associated with subsequent use. So this was path study data looking between waves 1 and 2. Those who reported first using a flavored product at wave 1 had a higher odds of using at the subsequent wave at wave 2. And we see that this is a consistent pattern for cigarettes, flavored or menthol in youth and smokeless in youth, but it's the same pattern across all products for young adults and adults. So first use of any of these flavored products being associated with subsequent use. And importantly, in terms of progression and potential harms from use, we see that first flavored product use is associated with subsequent daily use of cigarettes and e-cigarettes in youth, young adults, and adults. When we drill down on menthol products, menthol and mint cigarettes and cigars, and these are lumped together because of the item in the path data, again, we see a consistent pattern. New users of these products being more likely to use a flavored product in the youth and young adult age groups compared to older adults. And this is consistent for menthol in cigarettes. as well as flavors, both mint, menthol, and other flavors in cigar products. So similarly, again, we see this higher prevalence of new use of a flavored product in young people, but we also see that for menthol and mint cigarettes and cigars, we see relationships between new use of a menthol cigarette and subsequent past year use in young adults as for cigarettes. And then we see a similar pattern between new use of menthol or mint flavored cigars and past 30-day use in youth and young adults. So again, we see these consistent relationships between flavored use, uptake of tobacco products in young people, and the relationship between a flavored product use at early or first use and subsequent progression. On the other side, there have been a number of studies related to cessation among people who use menthol cigarettes versus non-menthol cigarettes. And we see that generally across a number of studies that there is a relationship between smoking a menthol cigarette and being less likely to quit. And while this is marginally significant in a full model, when we look at specific subgroups, we see greater reductions in cessation success among Black, African American, and Hispanics who smoke menthol cigarettes compared to non-menthol. So we have the initiation and cessation data. And then what is the final question for FDA is the population level impact. So looking at the potential, the contribution of menthol cigarettes to smoking prevalence over time. This is one of two modeling studies that I'm going to present from David Mendez and colleagues looking at what smoking prevalence would have looked like if menthol cigarettes hadn't been on the market. And you can see that the population smoking prevalence is this top line with the actual NHIS estimates in the open circles, and that there would have been a significantly lower smoking prevalence over time from 1980 through 2018 had menthol cigarettes not been on the market. And this translated to hundreds of thousands of excess deaths and excess life years lost, as well as additional smoking initiators as a result of menthol cigarettes being on the market over this time period, with a disproportionate burden of deaths and life years lost among African Americans. Interestingly, we see that the trends in smoking prevalence have not been consistent across these two, trends in smoking consumption have not been consistent across non-menthol and menthol cigarettes. So when we look over time from 2000 to 2018, we see significant declines in non-menthol cigarette use, with menthol pretty much holding steady over this time period. So over this 2018-year time period, we see 85% of this total decline in cigarette consumption attributed to non-menthol cigarettes. And if we push this out a bit, so these are data from 2008 through 2020, again, we see this menthol line pretty flat across this time period. However, when we look at new menthol products being introduced to the market, specifically the menthol capsules products like Camel Crush, we see that if those had not been on the market even, we would have seen a steeper decline in menthol cigarette consumption over time. So we have both menthol cigarettes as a whole sort of delaying or reducing the dramatic reductions in smoking prevalence, but we also see the contribution of these novel menthol products chipping away at successes that we might be seeing in menthol consumption as well. Over this time period from 2000 to 2021, we saw really dramatic changes in menthol market share. So from 2000 to 2009, there was about a 1% increase in menthol cigarette market share. Between 2009 and 2021, it jumped by 10%. So at this point, menthol cigarettes comprise about 40% of cigarette profits for tobacco companies. And we see similar patterns in flavored cigar use, where from 2009 to 2020, the flavored cigar market share increased from 45% to 53%. And you can see here the types of flavored products that have gained traction over time and are increasing in sales. And those are largely sweet or candy flavored cigars and concept flavored cigars, with fruit flavored cigars still being one of the top flavors sold, but now sort of being eclipsed by other flavors. Flavored e-cigarette sales are a bit different, and these data only capture sales from convenience stores. So we're missing anything that has been purchased in vape shops. But what we see here is, again, differences in the proportion of products sold under certain flavors based on the device type. So for pre-filled cartridges, recent data show that sales are led by menthol, and there are low sales of all other flavors, largely related to FDA's enforcement of flavor restrictions in cartridges. However, that portion of the market has been readily replaced by disposable e-cigarettes, where the top flavor in this category is all other flavors, and there are generally low sales of menthol products. In terms of the proposals that FDA has put forward and the proposed rule that we hope to become final this year, combustibles still remain a really important part of tobacco company profits. And so you can see here, this is from the British American Tobacco Annual Report from last year. The US comprises almost half of combustible revenue for the company. And if we look only at the US in this second figure, you can see that the majority of the revenues from all of their tobacco products in this category are from combustibles. And so that's 83% of their revenue coming from combustible products. And they highlight brands that have been highlighted for the past 4 years in their annual reports, Newport and Natural American Spirit, really being the drivers in that category for them. And they continue to focus on generating value from these products. So as we think about how we move forward in post-regulation, anticipating the industry response will allow us to maximize the public health benefit of flavored tobacco policies. And so in our group, Kevin Schroth has led a few papers in this area, understanding what might be coming and how the science and FDA and the law will support these policies being upheld. But we can also look to some of our neighbors to see what has actually happened in the real world, and even in our own setting. So these are data from Canada, just highlighting that in business-to-business publications, in the post-menthol ban in Canada, we're seeing these non-menthol alternatives where the word menthol on the package is being replaced with green. And we also see change in the colors of packs, similar to when light, low, and mild ban descriptors, light, low, and mild descriptors were banned. We see the changes in the color pack. So packs changing from green potentially to blue in response to highlight what the product is to consumers. In the US, the flavored cigarette ban created the emergence of clove cigars, which were essentially the same product. And you can see here over time, the flavored cigarettes were banned in 2009. So from 2010 to 2012, they did not sell any clove cigarettes in the US. They did not import any clove cigarettes to the US, but their clove cigars imports jumped up dramatically and ultimately did not result in any net change in sticks sold. And you can see here even potentially an increase in sticks sold in that later period. And of course, in California, what we're seeing right now in the face of a menthol cigarette ban is that companies are using synthetic cooling agents as a replacement for menthol to keep people using their products. So in some of the recent work that I've done with Ted Wagner, we looked at what potential menthol cigarette substitutes might emerge in the context of a menthol ban. And we had people try menthol roll-your-own cigarettes, menthol filtered little cigars, and non-menthol cigarettes. And what we saw here is that the menthol roll-your-own, which is in blue, outperformed the other potential substitutes compared to their usual brand menthol cigarette. And this is what is being currently marketed by some companies in business-to-business publications. Our menthol roll-your-own product was comprised of menthol pipe tobacco and menthol tubes, both of which are pictured here along with cigarettes and filtered cigars. So coming back to where we are now, some of our early studies on menthol prevalence and documenting the differences in the groups that were using menthol cigarettes, we see that in 2008 to 2010, we had an overall menthol prevalence of 35%. When we look at 2020 data from the National Survey on Drug Use and Health, that's up to 43%. The proportions using in different age groups have actually jumped up. The proportion using by sex has increased. And then for every group, except for non-Hispanic, Black, or African Americans, the proportion of past 30-day, past month people smoking cigarettes in the past month has increased. And so the only group that's changed is Black or African American adults, who are now at 80.7% rather than 88%, but again, dramatically higher than all of the other groups. So we have identified a number of ways in which the current actions by FDA can be pivotal for health equity. And one of the things that we highlight is limiting policy exemptions that lead to loopholes in inequitable implementation of these policies. This is some place where I think our current work and the modeling efforts can really inform the potential impact of these industry efforts on the potential public health benefits. Thank you.